Hello and welcome, my name is Chris from ChristopherHole.com and welcome to this video where we're going to be talking about the cruciate ligament sprain. Now, I'm going to break this up into a couple of parts over the next few minutes. First of all, we're going to look at what the injury is, then we're going to look at some anatomy involved, and we'll look at some possible treatment methods. So, first of all, the cruciate ligament sprain is, if you've watched my previous videos on ligament injuries, you'll see there's three different grades of ligament injury, and it can be any one of those. So it could be a grade 1 sprain, or it could be a grade 3. But as a general rule, cruciate ligament sprains are traumatic injuries, and what that basically means is it normally happens from one impact. Injuries that are could be described as non-specific, they tend to be the straw that broke the camel's back. So there's a lot of little injuries that go on under the radar that you don't really feel, and then eventually pain arrives. Traumatic injuries are slightly different. It's just one incident that causes that injury. So that's kind of how we have to think about the traumatic injury, because then we sort of treat it slightly differently. Some anatomy that's involved. You've got the anterior cruciate ligament, which is the one at the front of the knee, and then you've got the posterior cruciate ligament, which is at the back of the knee. So if you look at this diagram here, you've got these two that cross. The one at the front is the anterior cruciate ligament, so that's the one that goes across the front. Then you've got the one that goes across the back, which is known as the posterior cruciate ligament. Now these are the ones that could become injured. It could be from landing awkwardly, it could be from a tackle, it could be from twisting. There could be many different reasons as to why those ligaments sprain, whether it be a complete tear, which would be grade 3, or just a very minor tear, which would be a grade 1. So initially, it would be a case of certainly rest, ice, compression, and elevation, just to try and keep any swelling and bruising at bay, but we do want that to come out eventually. When we talk about police, this would be a little bit further down the line in a sort of a rehabilitation, because we've got optimum loading involved in this one. Depending on the ligament that is sprained, we would be looking at knee extension and also a hinged knee brace. A more long-term sort of treatment plan would be hip and ankle stability. So you've got the hip above and you've got the ankle below, holding the knee joint where we want it. So if you watch people squatting or lunging and you watch their knee wobble in and out, that basically is a demonstration of an unstable ankle or an unstable hip. So it's making sure, certainly with your knees that are injured or an injured knee, it's making sure that that knee tracks in a smooth way, rather than it starts in the middle, then it drops in, and then it pushes back out again. It needs to track in a nice, easy sort of straight line, if you will, and that comes by stabilizing the hip and stabilizing the ankle. So the hip is obviously above and the ankle is obviously below. So just to go back over what we've talked about, the cruciate ligament sprain is a traumatic injury that involves the anterior cruciate ligament and the posterior cruciate ligament. Various different treatments. If it's grade 3 surgery, rest, ice, compression, elevation. Depending on the ligament, knee extension. Get yourself a hinged knee brace, so again that helps it track and stabilize the femur on top of the tibia. And then a long-term plan would be hip and ankle stability. So hopefully that's been helpful. Hopefully it's given you a little bit more insight. Many thanks for watching. My name is Chris from ChristopherHole.com. I'll speak to you in a future video.